The big thing in reality TV nowadays is medical dramas. From House to Grey's Anatomy, beautiful doctors perform extraordinary surgeries and procedures, the camera pans to an ECG machine beeping out of control, and a patient unfortunately passes on.
VTAC, she's in VTAC.
All right, let's just pace her out of it. Take it to 330.
BP's down, 60 over 10.
Damn it.
She's not breaking. Kraft, get in there now. Wait, hold the shot.
But what do these ECG machines actually tell McDreamy and McSteamy? Let's start with understanding the basic anatomy of the heart. The heart is composed of 4 chambers, 2 atria and 2 ventricles. Blood from the body returns to the heart into the right atrium, flows through a valve to the right ventricle, then travels to the lungs to become oxygenated. From the lungs, blood travels to the left atrium, through a valve to the left ventricle, and from there, the blood is pumped through the aorta to the entire body to provide oxygen to tissues and organs. Now let's back up a couple steps. How could an organ the size of your fist actually pump blood to the entire body? The heart is composed of muscle that can contract and relax. We call it cardiac muscle. This cardiac muscle is made up of lots and lots of tiny cells called cardiac myocytes. Ions moving back and forth across the cell membranes changes electrical activity and powers the cardiac muscle to contract and pump blood through the heart and out to the entire body. So how does this all translate to an ECG trace? 2 probes are put on the patient before we start seeing anything on the screen. A negative probe on the right arm and a positive probe on the left leg. This creates a lead 2 ECG trace. These probes pick up changes in electrical activity and display the results on a screen. We start with the heart at rest. This will just show a flat line. When the heart is ready to beat, blood will flow to the atria and they are ready to contract and push blood to the ventricles. Electrical currents in the cardiac myocytes will travel through the atria. This creates the first bump of the ECG, the P wave. Next up, the ventricles. Once all the blood has been pumped into the ventricles, they now need to contract to pump the blood to the lungs or to the body. Electrical changes in the cardiac myocytes travel through the ventricles, and since there's a lot more muscle in the ventricles, this produces a much bigger spike. This is called the QRS complex. Finally, after the blood has been pumped out of the heart and into the body, the heart relaxes and prepares for the next beat. Ions move out of the cell membrane to rebalance the electrical activity of the cardiac myocytes. This creates the last bump of the trace. We call it the T wave. And there you have it, 1 heartbeat. Here we are back at the beginning, waiting for the next one. Doctors use ECG machines to monitor heart rate, observe cardiac electrical activity, and look for heart rate abnormalities. Maybe with your newfound knowledge, you too can understand ECG traces along with your favorite TV and real-life doctors.